Face washes, when I'm talking about face washes, it really is a serious matter. So the major differences between the soap and face washes, let me summarize for you. Now, moving forward towards the debate for cleanser versus face wash, you need to know the skin types. Once you know the skin types, you can choose the face washes better suited for those skin types. Assalamu alaikum everyone, this is Dr. Aisha Ghias, and today we are going to discuss a very exciting topic. This is about face washes. Not only the topic is excited one, but it's a topic which is most commonly ignored one as well. From a dermatologist perspective, I remember the times when we used to write face washes at the back of the prescription, or we were kind of reluctant to use to write the face washes, probably because it was thought to be unethical to write face washes in every prescription. And probably also we thought that this is something which is not needed at all, and the patient is going to ruin his or her money on face washes. Rather than face washes, we should prescribe some drugs, medicines, oral or topical, whatever. So the face wash was an area which was kind of neglected, ignored, and we were reluctant to write it. But then it was one of my tasks to present about face washes at an international forum, and I went through all the preparations for that. And then I realized maybe I could have done this years ago, probably a decade ago, and that would have made my prescription far better than it is today. And after going through this preparation of the face washes, on the presentation of face washes, I came across so many new facts that I didn't know before. So when I presented on that forum in Thailand, there were few Japanese as well, and they were extremely excited about it. They were, they were like they didn't know many of the things which I presented in my presentation. And out of all the Pakistani colleagues that were there, almost 80 to 90% were of the view that face washes were very important, and we didn't know that. And after today's presentation, we are probably going to strengthen our prescription with the face washes. So this was a very, it was a motivating comment. And they also wanted me to record the presentation again for them to be available for them to see whenever they feel like, so that all the information given in the presentation should be handy to them, and they can access it anytime they want. So the presentation is ready for you today, and I'm going to record it all over again. So it was about face washes. Okay. So, face washes is one of an area which is very, very, very important in daily skincare routine perspective, and at the same time, it is kind of an ignored thing from a dermatologist perspective. We tend not to write face washes, or we tend to write it at the very last step of our prescription writing. Probably we think it's not very important in treatment point of view, and a patient is going to ruin his or her money on face washes. Rather, we should prescribe some oral or topical drugs for the skin problem the patient has come with. But when I went through the preparation of this presentation, I collected all the data, I went through the international researches. I came to know that face washes can be a very useful aid for the treatment of your patient. And you can rely on some things, if not all, on the face washes to help treat your patient. And this requires integration of the face washes with your prescription, and they should complement each other. How they should complement each other, you will learn in a few minutes. This is the area today which I'm going to talk about. So, face washes, when I'm talking about face washes, it really is a serious matter. When I disclosed that I'm going to prepare a talk on face washes, my daughter was like, "Oh, Mama, you're going to talk on face washes? This is something which probably everybody knows. But this is something which everybody should know, but probably they don't know." Whenever we go to some superstores to have some face washes for our skin, or for that matter, for someone in our family, probably daughters, then the important thing to look for is the budget. And after budget, what type of skin and face wash do we want? Do we want a hydrating kind of face wash, or an oil control face wash, or we want face wash with some specific ingredients in them like salicylic acid or glycolic acid? When my daughter is along, probably the most important thing is the look of the face wash. How does it look? Is it pink or yellow, or is it a beautiful bottle? So the things like that. But after today's talk, if you listen to it carefully till the end, you'll come to know that there are so many other things to be considered when choosing a face wash. So the first important thing is acidic or alkaline. It's a concept. The skin is acidic mostly. The skin surface is acidic by birth. The pH ranges between 4.6, 4.5 to 6.5. So it's highly acidic. Neutral pH, as you all know, is 7, and the alkaline pH starts after 7. So once you know that your skin is acidic, probably this is the highest defense Almighty could give us. And this defense does not allow many of the microorganisms to get into your skin. It allows some of the commensals to be there to grow, and these commensals then stop the pathogenic bacteria from getting in. Also, this acidic pH is very good to control the flora, control the oil balance, and to control the keratinization process, and so many other things. So the pH is very important, and we need something to wash our face that should aid in keeping the pH acidic. We do not want to keep the pH neutral or towards alkaline. And for your kind information, all the face washes are helpful in keeping that pH acidic, while the soaps do not keep the pH acidic. They all are alkaline. So once you're washing your face with something that is already alkaline, they are going to increase the pH towards normal range, neutral range, and then further usage of soaps, the bar soaps, can lead the pH towards alkaline range. What does that alkaline pH mean to you? The alkaline pH is something that makes your skin flaky. When you wash your face with soap, you feel like your face is exquisitely clean. It's suspiciously clean. Like when you swipe your finger on the face, you feel like you're swiping your finger on a very neat and clean surface. It's not greasy at all. It's not soft at all. It's like very much clean. So this is the point. The alkaline things, when wash your face with alkaline soap, bar soap, it takes away all the protective fats that are there on your skin that your glands are secreting as a protective defense barrier. And when the soaps washes all these protective layers of fat on your skin is very much vulnerable to trauma. It's very much vulnerable to get cracky. It's so much vulnerable to get those infections that can be there. And it's very much vulnerable to the acne breakouts. So alkaline soaps, a big no-no, and face washes, a big yes. Then there is another debate, which is about face washes and cleansers. The first question that comes to our mind is that why at all do we need to go for dermoscopy? Can we diagnose every dermatological lesion on our own clinically, or do we really need to go for biopsy? And why at all do we need to go for the dermoscopy, which stands in between the clinical and the biopsy? So the naked eye presentation, as you may see on the left side of two lesions, appears almost the same clinically, but when you go for the dermoscopy on the right side, as you can see in the upper lesion, you may see the pigmented network, and the network is kind of the regular one dispersed throughout the lesion. However, in the lesion lower below, in the lower picture on the right side, you may see these isolated dots and clots in the periphery of the lesion. Now, cleansers one step ahead to face washes. This is kind of a posh concept. With the face wash, you're going to wash your face. You can a little bit have some therapeutic point of view, some ingredient in them that can aid your treatment process. But with the cleansers, you will not only clean your face, but you're going to be a little bit gentle. You're going to be a little bit superficial. Although the cleansers are very good in cleaning the pores, but they are not very good in taking away all the fat. So they do not disturb your natural defense barrier of the skin. They do not disturb the natural fats that are being secreted on the surface of the skin by your sebaceous glands, but they are going to take away all the impurities, makeup, dust, the dead keratin layers and all that. So cleanser is one step ahead than face washes, and sometimes we can double cleanse. Double cleaning is a concept which is a very recent one, and it's very much helpful for those who are having persistent oil related problems, persistent clogging of the pores. So for them, it's very good. So the double cleansing is a concept which we'll touch in a minute, and it's one step ahead than cleanser. So we are, we are crossing the posh concept step by step. We're going towards that perfection that our skin needs, and which is technically possible with use of these face washes. Obviously, when you care for your skin day by day, day after day, time to time, on a daily basis, you make a routine, you make it a habit, only then you see positive results on your skin. It's not for a day or two that you start cleansing your face with a cleanser or a face wash, or you double cleanse your skin and you're going to see that glow which is claimed by those face washes or cleansers. But it's over weeks and years that you see changes. That's why Korean skins are very beautiful. They are glowy, they are transparent, because they are in the habit of using that skincare products over time, and they have set routines that they are using. Firstly toner, then serum, then moisturizer, then eye cream, then sunscreen, and then maybe a little bit of the makeup. So they have all the steps with them. They have memorized those steps. They are practically doing them every day. So that's very important. And last but not the least, expensive versus economical. Sometimes the ingredients in the face washes are the same, be it an expensive one or an economical one, but there are so many other things that the manufacturer is keeping in mind. This is like biodegradability, the emollients in them, the moisturizers in them, the treatment point of view, say what are the chemical ingredients in them that are going to aid in treatment. For example, the antibiotics, the antiseptics, the multivitamins, and of course the alpha hydroxy acid and the beta hydroxy acids and things like that. And then there is a solubility, the finish of the product, it's a foam or a gel or a liquid. And then obviously the feel of that face wash or cleanser, the after feel of that cleanser, the aroma or the scent it has, the color what it is having, the solubility or the emulsification of the products in them, whether you have to shake it before use, and so on and so forth. So expensive versus economical does not mean that the ingredients are different, but it means so many other things. What we are practically concerned is with the ingredients. So same ingredients can be there in the economical one as well as in the expensive one. But obviously spending money on the expensive one is going to yield you more results if the company is authentic, if it's a multinational, a trusted one with good reviewers, and it's dermatologically tested, of course. So having said all that, let's go further towards talking about face washes. The soap making industry is very old, but not very much old. I have seen soap making thing back in my village in childhood. It's a very interesting kind of process. They mix up those alkalis and the fats together, and then there is water coming out of them, and the raw soap is formed. It's the solid coming out of the liquid. It's very interesting to see that. And the industry started almost in the mid of the 18th century, the soap making industry. And then after a century started with these face washes. There are so many face washes available in the market, but initially, obviously, everyone can say that our grandfathers and grandfathers were not in the habit of using face washes. Still, they had very neat and clean skins, very young skins, and almost flawless skins. How was it possible? So the answer is that they were having good diets, they were having good skin routines, they were in an environment that was not having a lot of pollution in it. So probably they were already in a protected sort of environment with so many perks around, which we are not having at the moment. So probably we need to have some extra care of the face. And obviously with the passage of time, there are new things coming in the market. The washing machines have changed. Now you can, wash your clothes and dry them in one machine. It's an automatic one. You don't have to touch the water practically. So with the evolution, with development, you get to know the things which were not there in the past. That really does not mean that they're not good for you. They might be good for you. What's a pattern and what is a clue? So pattern is a structure that you see in more than 20% of that field which you are seeing with the dermoscope or the field of the dermoscope. So more than 20%, if you see something, it's a pattern. And if less than 20% is a clue. Yes, pattern and clue. So pattern is more than 20% and clue is less than 20%. Okay. So as for example, in the left hand side, you see that the pigment network is present in more than 20% of the lesional of the surface area that you are seeing with the dermoscope, and we call it a pattern. So there is a pattern of pigment network. However, on the right hand side, if you see this clod, is it a pattern or a clue? It's a clue. So the major differences between the soap and face washes, let me summarize for you again. Soaps on the left hand side, as you can see, they are harsh. They're alkaline, they dry out or they extra clean your skin, while face washes, on the other hand, they are gentle, they are subtle, they maintain that acidic pH on the skin like very sufficiently and very optimally, and they gently clean out. They do not clean out very like extra cleaning step is not there. Soaps can disturb the skin barrier because they take out those superficial keratin layers as well when they wash. They activate some enzymes over there, which activate then proteolases, and those enzymes can actually dissolve the superficial keratin layers on the skin. So that's why you feel your skin is extra clean after using some soaps. So this is not a desirable thing. While on the other hand, face washes protect the skin barrier. They do not tend to dissolve those superficial keratin layers from your skin. All right. Now, another negative point with the soaps is that they do not clean the pores. Then what's the fun of using them? I mean, if someone who has got dirty pores after a full day's work, or the pores are very much inclined towards being clogged, or someone has cloggy pores, someone has a tendency towards having the clogged pores, the comedonal skin, soaps are not good for them. While on the other hand, face washes deep clean the pores. They are not customized. You cannot customize the soap for the clients, and they are difficult to carry. Of course, they are not user friendly. You cannot put your treatments into the soaps. While on the other hand, face washes can be customized from the treatment perspective view. They can use some ingredients in them, so they aid the treatment, and most of all, they are user friendly. That's why we can keep face washes in our bags when we go anywhere outside our homes, but we cannot, of course, carry the bar soaps. All right. Now, moving forward towards the debate for cleanser versus face wash, another posh concept. One step ahead of face washes is a cleanser. The function is almost the same, but face washes reduce dirt from the lowest skin layers and cleanses the pores, while the face cleansers, they clean the surface of the skin from impurities, makeup residue, and excessive oil. Face washes are ideal for oily and combination skin types, while face cleansers are good for dry and sensitive skin types. This is very important. They are used mostly in morning, while cleansers are used at night. Moisturization is low with face washes, but it's high with cleansers. They are gel-like and they may form. They are gel-like, and they may make foams. Foamy हो सकते हैं, but the cleansers are usually creamy or milky. Okay, the gracefulness, less harsh than soaps, but cleansers are less harsh than face washes. So cleansers are for the dry or the sensitive skin because they are less harsher than soaps. And face washes make foam, they make leather, but cleansers usually do not. Keeping in mind all these parameters, all these points in favor of face cleansers, they are not necessarily have to be washed off your face when you use them, while face washes obviously need to be washed with a lot of water. All right. So is face wash or cleanser better, or the soaps are better? What is your answer after all this discussion? And I'm sure your answer is yes, face washes or cleansers are better than soap. All right, so my next question would be which face wash to use, and your next question obviously would be the same one. So now you need to know the skin types. Once you know the skin types, you can choose the face washes better suited for those skin types. Usually we divide them into normal, oily, dry, and combination skin types. Let's go through them one by one. And how do you know your skin type? Okay, there are some people, when I ask them what is your skin type, they are pretty much sure, but some of the patients come to me and they say, Dr. Aisha, what is my skin type? I mean, this is a question which I should ask them, that what is your skin type? Instead, they are asking me what's my skin type. So my answer is, if you have a blotting paper at home, or for that matter, a tissue paper at home, wash your face with any cleanser or face wash available at home, and then after an hour, press that blotting paper onto your nose and see if it's oily or not. If it's a little bit oily but rest of the skin on your face is dry, probably you are having a combination skin. If the blotting paper is oily everywhere on your face, your skin is oily. If it's dry all around, your skin is dry. And if the blotting paper is a little bit oily only on the nose and elsewhere it's okay, then probably your skin is normal. So this is the blotting paper method of knowing the skin type, and you can easily make the patient understand this method. And by deploying this method, you and the patient can confidently know the skin types they are having. After you know the skin type, okay, so now I'm going to talk about the oily skin care. Okay, there are some perks and challenges of the oily skin. You need to understand the concept before we pick up the face washes and the right skincare products for the oily skin. What are the perks and what are the challenges? The oily skin is excessively shiny, as you can see in this picture. It seems glowing, but at the same time, it has enlarged pores and it's prone to clogging. So, as it's prone to clogging, the patient might have blackheads, whiteheads, and obviously one can have breakouts. So, what are the recommendations for oily skin? Oily skin should use a face wash, and that face wash should be a deep cleansing one. It can be an exfoliating one, and the granular face washes would work best for these skin types. Followed by washing the face, then you follow it by toner, by serum, eye cream, moisturizer, and of course the sunblock. These are the normal skincare routine steps, and I have already uploaded a video on my skincare. How do I do these steps one by one? So this was about the oily skin and the face wash choice that you're going to have it. Obviously, once the patient is prone to get clogging and blackheads and whiteheads, you may use a face wash that has salicylic acid, glycolic acid, and other fruit acids in them. It would be good for them. Okay, this is going to be the chapter 3 of dermoscopy. And in chapter 3, as I promised earlier, we'll be discussing about the chaos and clues method. This is one of the dermoscopic methods in diagnosing skin lesions. And all right. So, dry skin. So, what are the perks and challenges? Dry skin is usually acne free, but it's very much vulnerable and flaky. It can get irritating. It appears a little bit dull and lusterless. You need special care for this dry skin. So, moisturizer is not enough only. The recommendations would be that you should use a foaming facial cleanser. Okay, and a gentle exfoliation once per week would be good to remove those flakiness flakes from the surface of the skin. Toner should be a hydrating one. The toners are of many kinds. There are hydrating ones and then there are oil controlled ones. So toner should be hydrating one. Then the serum should contain hyaluronic acid. Eye cream is obviously must for the dry skin people. Face oil or moisturizer can also be used, followed by sunscreen, and hydrating face mask would be a bonus for those who are having dry skin. So once every week or twice every week, if they use the hydrating face masks or the sheet masks hydrating ones, they're going to have visible results on the skin. Okay, going towards the combination skin types. What are the perks? The perks of combinations. I have a combination skin and my skin gets oily from the middle, from the nose, and a little bit on the forehead. And it's very much dry otherwise. It's normal otherwise. So my skin is a combination one. It's dynamic. It changes with atmospheric temperature, humidity, your diet, lifestyle, and the hormonal changes, and it has conflicting concerns. Sometimes you have to fight with acne and sometimes you have to fight with the dryness on the skin, but it's rewarding at the same time. So what are the recommendations for the combination skin? You're going to use deep cleansing foaming face wash, not the cleanser, and mild hydrating toner would be working good for you, or a herbal toner. Skin strengthening serum like the one which should contain hyaluronic acid and vitamin C. Lightweight skin oils can be used in the periods of dry skin time, and eye cream is obviously a must. Lightweight moisturizer can be followed after all these things, and obviously a sunscreen if you're going out in the sun. Fine. Okay, coming to the sensitive skin. In Pakistan, almost 50% females, 60% rather females and 50% males claim that they have sensitive skin, and soon after applying any kind of skin product, they usually have tingling, burning, or redness on the skin. But sometimes they are not right. They are applying wrong products. They are applying it wrong time. They are applying the products with the wrong method, and many a times they are not sensitive, but the skin lands up sensitive by these misconduct on the skin. So sensitive skin is the one that results from barrier disruption. The normal skincare barrier, which is there pretty much on everybody's skin, is disrupted. This skin is stressed or traumatized, and it's very much prone to get problems. It's the experimented skin, like I just told. Patients are in the habit of applying those mixed creams and blah 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 for the fairness. It's very much difficult to manage. It heats up quickly. Whenever patient goes in front of the stove or in kitchen or outside in the sun, they say that their skin gets heated up. And the product hacks that they use are not good for them. Triggers are very much important in the sensitive skin, like fragrance, alcohol, colors, humidity. They are the triggers for dry skin. What are the recommendations? The recommendations for dry sensitive skin are that they should use cleanser instead of the face wash. Herbal toners are going to work for them. Hydrating serums and peptide serums or oils for hydration, followed by a moisturizer. Then, of course, an eye cream, sunscreen, and face mask is again a bonus for them who are having a sensitive skin type. Normal skin type, on the other hand, has no major concerns. It needs a very low maintenance. Exfoliating face washes can be rewarding for this skin type. Normal skin type, mild toner will work good. Hydrating serums to have the glowing in the skin, and then moisturizer should be there to lock that serum into the skin. Eye cream is a must, and sunscreen obviously.
मेरी जो एप्लीकेशन है इसका नाम है स्किन चेक प्रो, और जैसे कि मैं आपको अब ये दिखा रही हूँ कि हाउ डज़ इट वर्क. बेसिकली व्हेन यू ओपन इट अप तो यहाँ पे राइट साइड पे आप देख रहे हैं ब्राउज फाइल्स की ऑप्शन है. वंस यू ब्राउज फाइल्स तो आपके सिस्टम में या फ़ोन में मौजूद पिक्चर्स यू कैन पुट देम अप इनटू दिस ऐप, एंड विद इन अ फ्रैक्शन ऑफ अ सेकेंड दिस कम्स अप विद अ प्रॉपर diagnosis. As you can see on the left hand side, it has diagnosed the skin lesion as melanocytic nevi with 68% probability and with.
Okay, so now having said that, let's look at the type of face washes that we have in the market in terms of their finish. They can be gel, they can be foaming, cream, or powder. Alright, so they can be found in any form. Same goes true for the cleansers. They can also be found in the gel form, cream form, foam, oil, powder, or clay. And I have also written the recommendations. Which type of skin would benefit best from which type of cleanser? Similarly, I wrote it over here in the face washes. That, for example, for the gel face wash would be for the deep cleaning purpose. It is helpful for unclogging the pores and acne and bacteria. Foaming face wash is good for thick leather formation, removing extra sebum impurities and pollutants. Creamy face washes are good for hydration. They spare the natural face oil. They are ideal for dry sensitive skin, and powder forms are for sensitive skin. Similarly, like for cleansers, I have written all these recommendations. You can go through them, pause this presentation a bit, and then read it out. Alright, double cleansing is a buzzy trend. It just gives a second punch after that first punch of face wash. So the second punch is with that of a face wash, and the first step is obviously a cleansing balm or a micellar water. So you are using two products at one time. For example, at night time, you first wash your makeup, impurities, pollutants, dust, and extra oil with the help of that cleanser. And then afterwards, you wash or you cleanse your pores with the help of a traditional face wash or cleanser. So this is a game changer for those who have easily cloggable skin. It's good for them. Alright, so now talking about the ingredients in the face washes, there are so many face washes. Whenever I come across a bottle of the face wash at some superstore or pharmacy, there are at least 20 to 40 products written on the back of this bottle. But we are familiar with only few of them, because as doctors we are concerned with the products that are meant for the treatment point of view, that are important from the treatment perspective. Otherwise, obviously, in order to make a proper face wash, all these things are important from emulsification point of view, from dissolution point of view, for the final finish of the product, the color that they have, the preservatives that they have, the granular thing that they're having. So everything is important, obviously. But mostly we are concerned with glycerin and hyaluronic acid, salicylic acid, citric acid, and panthenol, etc. So, my dear fellows, I'm obviously I have a YouTube channel from which I'm talking to you right now. So I usually make videos on skincare. and they are meant for the public awareness because they are in the local language, and probably this is the only channel in Pakistan that is taking care of all the skin matters in the local language, easily understandable language for the public to know. So you can follow me there on this channel, and you can help me make useful videos for the public if I have just missed out anyone. And I do have a Facebook page as well. You can follow me over there. Thank you so very much for bearing with me for this time and listening to my presentation. If you have any questions regarding face washes, you can just let me know in the comment section, and then I'll be replying you over there as well. Thank you so much.